Hi, everybody. It's Dr. Manny. I wanted to give you an update that from a recent publication looking at the risk of birth control pills usage and blood clots. We know that all artificial hormones have been linked somehow with clots in your legs or your lungs. The probabilities are not high, but they're above the normal, especially if you have certain risk factors like smoking or family history of blood clots. Now, the study basically talks about the new birth control pills. Birth control pills have had an evolution, and especially with the progesterones used on the new birth control pills as compared to the old birth control pills. There is an optic, if you will, of a higher increased chance of developing a blood clot. The reason that I want to talk to you about this is because this is the kind of conversation that you need to have with your doctor. If you're thinking of having or taking birth control pills for contraception, again, a thorough physical should be done, a good questionnaire looking at your family history for risk factors of clotting or histories of deep vein thrombosis or strokes. And if you have that kind of history, then there's blood work that needs to be done. And then, of course, you can go on the birth control pill. Talk to your doctor about, what kind of birth control pill do you need? Because again, this is all predicated on your menstrual cycle, on things of this sort. Also, the other question is, if you don't need to be on birth control pills, do not take them. Because at the end of the day, you're exposing yourself to a risk, which is minor, but still a risk, so that you should not consider birth control pills if that's the case.